Welcome to CHPN Part 1 Hospice Philosophy and Regulations. This section covers the foundation of hospice nursing practice, including the philosophy of hospice care, eligibility requirements, and the 4 levels of hospice care. Understanding these core principles is essential for both the CHPN exam and real-world hospice practice because they guide every clinical decision we make. Let's begin with hospice philosophy. Hospice care focuses on comfort, dignity, and quality of life rather than curing disease. The goal is not aggressive treatment, but symptom management and peaceful support during the end-of-life process. Hospice care is holistic and includes physical, emotional, psychosocial, and spiritual care. It is also patient and family-centered, meaning the entire family unit is considered part of care. It is important to understand the difference between palliative care and hospice care. Palliative care can begin at any stage of serious illness and may be provided alongside curative treatment. Hospice care is specifically for patients with terminal illness when the focus shifts from cure to comfort. Typically, hospice eligibility requires a prognosis of 6 months or less if the disease follows its normal course. To qualify for hospice, a physician must certify that the patient has a life expectancy of 6 months or less if the illness follows its usual progression. This does not mean we are predicting an exact date of death. Rather, it reflects clinical judgment based on decline, disease progression, and overall condition. Patients may remain on hospice longer if they continue to meet eligibility criteria. There are 4 levels of hospice care, and understanding these is very important for the CHPN exam. These include routine home care, continuous home care, general inpatient care, and respite care. Each level is based on patient needs, symptom severity, and caregiver support requirements. Let's review each level individually. Routine home care is the most common level of hospice care. It is provided when the patient's symptoms are stable and can be managed in their residence, such as home, nursing facility, or assisted living. This includes regular nursing visits, aid visits, social work, chaplain support, and physician oversight. This is not continuous bedside care. Continuous home care is used during a short-term symptom crisis to prevent hospitalization. Examples include severe pain, respiratory distress, uncontrolled dyspnea, or terminal agitation. This level involves extended nursing care provided in the home for at least 8 hours in a 24-hour period, with most care delivered by an RN or LPN under RN supervision. The goal is crisis management and stabilization. General inpatient care, or GIP, is provided when symptoms cannot be safely managed in the home setting. Examples include severe uncontrolled pain, active bleeding, severe dyspnea, seizures, or complex symptom management requiring intensive monitoring. This level is short-term and focuses on aggressive symptom control in a hospital, hospice inpatient unit, or skilled nursing facility. Respite care is designed to provide temporary relief for family caregivers. The patient is admitted to a facility for short-term care, usually up to 5 days. This helps reduce caregiver burnout and allows families time to rest while ensuring the patient continues to receive safe care. Respite is for caregiver support, not for symptom crisis management. In summary, hospice care focuses on dignity, comfort, and quality of life. Understanding hospice philosophy, eligibility, and the 4 levels of care is foundational for both clinical practice and CHPN exam success. Always remember, routine equals stable, continuous equals crisis at home, GIP equals uncontrolled symptoms requiring inpatient care, and respite equals caregiver relief. Mastering these concepts will make many CHPN exam questions much easier to answer.